Hello everyone, it's Angel Grace B. Moscoso, a caregiving student. In this video, I am going to demonstrate on how to assess with vital signs on an infant. Therefore, first, we are going to take the respirations, followed by the heart rate, then the temperature, the weight, the length, the head circumference, and the chest circumference. Before we get started, make sure that you gather all the equipment. All we need is a stethoscope, a measuring tape, a thermometer, a scale, and a watch. Make sure that you are going to sanitize everything you are going to use before and after use. To start, I am going to sanitize my hands first. So, we are going to sanitize everything that we are going to use. Put an alcohol. In checking the respiration, make sure the infant is lying nice and calm so that we can get the accurate reading. So, let's look at the nose. Infants love to breathe through their nose. So, we are going to check their nostrils. And we are looking for the nasal flaring. And as you can see, there is no sign of nasal flaring. So now we are going to check the chest. We're going to check the chest if there is a retraction happening here. So as we can see, there is sign of the chest retraction. Lastly, we are going to check the infant's skin color and skin tone to see if there is any symptoms and signs of cyanosis. What we are going to do is to count for 1 full minute the rise and the fall of the chest. Lightly place your finger in the chest and feel the rise and the fall. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 33, 34, 35, 36. We're going to check the infant's heart rate. So the normal infant heart rate is about 100 to 190 BPM. After 1 month, it will be 90 to 180. So in counting the heart rate, we are going to use the apical pulse, not the radial pulse like what we do in an adult. Counting the heart rate, we are going to find the apical pulse. After we find the apical pulse, we are going to put the stethoscope in here and listen for the 1 full minute. Now we are going to check the temperature. So a normal temperature of the infant can vary between 36.4 to 37.4 degrees Celsius. To take the temperature of the infant, make sure that you turn on the thermometer and put the tip of the thermometer at the folds of the armpit of the infant and wait for the thermometer to beep. After the beep, look at the result and document it to check the weight of the infant. To obtain the weight of the infant, remove the clothes and the soiled diaper. A dry diaper can be used. Place the infant on the scale and obtain the weight. The infant weighs about 10 pounds and 2 ounces. Document this and look the infant's previous weight and compare it. Now we are going to measure the length of the baby. To measure it, lay the baby on the surface that you can mark. You will need a pen for this and someone's help to measure the baby from head to heel. Lay the baby's back. Put the head in the midline. Mark the head. You will go into this and mark the head. And take her leg and extend outward. Like this. And mark. After you mark the head and the heel, lift the baby gently and put it aside. After you lift the baby, measure the marks using the measuring tape. We're going to measure the infant's head circumference. So, a normal head circumference in an infant is about 30 to 38 centimeters. Gently lift the head and put the tape measure in the largest part of the head. Like this. We are going to place it a little bit above the eyebrows. And the head circumference of the infant is about 34 centimeters. And that is normal. Now we are going to measure the chest circumference. In the chest circumference, we're going to use a measuring tape again. Wrap it around here. And then, the infant chest circumference is about 36 centimeters.